So with this laser, it's got a wavelength of 1927, and that's a really good wavelength for treating Australian skin. It's wavelengths are absorbed by water, and it's absorbed so well that it really targets the top layer of the skin, or the epidermis, and that's where we get the age spots, the pigment spots, the precancerous lesions, and all the things that sort of lose that luster and glow of the skin. But deeper down, it also has a really good effect to repair the interface between the top layer of the skin and the collagen layer. And this often does get damaged by the sun, and that can be responsible for a whole lot of skin problems, be it melasma or other inflammatory conditions. And then the good part, it gets into the collagen layer, but not too deep, so you've got a fast recovery, but it gets to that really sweet spot in the collagen layer where you get a really good collagen response with remodeling, new collagen production, along with new elastin. So with Lutronics ULTRA 1927, it's a really good option for people who have sun-damaged skin. That, number one, it can treat precancerous lesions, but if you have regular treatments, it's been shown to reduce your future risk of a number of sort of squamous or surface layer skin cancers. But I think now the big thing people hate, it's that dyspigmentation or age spots due to the sun, and this can be very good for really targeting those lesions. But then again, the other big thing, we get that elastosis, or that wrinkles, lines, and again that loss of that collagen glow, and it can be really good to repair that top layer of the collagen layer, which really improves the way skin reflects light and the appearance of the skin. Okay, so with the Lutronics ULTRA 1927, it's classified as a non-ablative laser, which is great. That means not a lot of downtime, a good quick recovery, not a lot of complications with your skin care and that recovery period. But in many ways, it has the benefits of an ablative laser. It's so well absorbed by the water, it really ablates the damaged part of the top layer of the skin, but it preserves the very surface, so you've got a nice wound dressing to have that rapid healing underneath in a really good environment. So it's as effective in many ways of many ablative lasers, but for safety and recovery, it behaves as a non-ablative laser. So with the Lutronics ULTRA 1927, it's a great standalone laser, and you get a really good response with just that for a lot of skin problems and skin conditions. But often you get a mixture of changes in your skin due to age and photo damage, or background medical conditions such as rosacea. So often you want to target redness, and you want to target the wrinkles, collagen damage, and pigment spots. So we often really like to start with either a vascular IPL or rejuvenative IPL setting, or a vascular laser to address that redness or capillaries. And that actually increases the chromophore in the skin. So if you then immediately follow it with the Lutronics ULTRA 1927, it improves the benefit for the epidermal changes of pigment spots, actinic keratoses, but also you get a better collagen and fine line and wrinkle response as well. And I think, as you said, I've mentioned combining this laser with IPL and vascular, which can be a really great combination for the mixture of changes that happen with both age and photo damage. But it also has many other benefits, that it's one of the best lasers to enhance delivery through the skin of active. So if you do a treatment with the Lutronics ULTRA 1927 laser and then put a skin active, it gets into the skin, into the living layers, and that coagulation zone it produces also provides a reservoir where that active then diffuses over the next few days for speed of healing and added benefits. But we also use it to improve a number of our other treatments, such as photodynamic therapy. And this is a great one for treating precancerous lesions or early skin cancers. And by doing the Lutronics ULTRA laser first, you get a response maybe 2 or 3 times better than if you just did the treatment alone. Okay, so one of the favourite bits regarding this device and for treating our patients, with the Lutronics ULTRA 1927, it's that enhanced delivery of active through the skin immediately after treatment and in the week afterwards. So it's a really great opportunity after a treatment to put things on the skin that are going to sort of speed healing, improve recovery, but also to enhance both the collagen response and maybe target skin problems. So if someone has melasma, other pigmentary things, we can add other things that can help address that and remove either pigment lesions or improve melasma control, or again actually avoid some of the adverse reactions with laser where you could get worsening pigment from too much heat. So this device is really good to help us deliver things that are going to help reduce problems, speed healing, and enhance outcomes. Okay, so there are quite a few 1927 lasers on the market, but the Lutronics ULTRA has, some really good modes that make it sort of stand out and made it a really good choice for our clinic. That one of the key ones is the random mode, that normally with the lasers you get a line of shots of laser that build up, they heat the skin, and that's what causes pain, and that heat can also cause an increase in adverse risks such as post-inflammatory pigmentation after your treatment. But if you have a random pattern, you're still getting the same full treatment, but there's time between the spots that are adjacent, so you don't get that same bulk heating effect, and that makes it much less painful for the patient, but also improves the safety of laser, but you're not reducing the outcome. In fact, you're usually improving the outcome because patients tolerate the treatment so much better than this traditional sort of linear delivery of the laser. And another sort of favourite mode for this laser, being a dermatologist, often patients come with lesions they want removed, and it's got a really nice stamping mode where you can really target the problem lesions. It could be an actinic keratosis or pre-cancer, or might be that age spot that people really hate. So although we like to do a field treatment to rejuvenate, pick up the new lesions that might develop or become more apparent, people really want their problem lesions, or the one they've come about, addressed effectively. And that stamping mode is great to really target it. You can do multiple passes, adjust the energy, but then you do the field treatment over the top to get that nice result. But also it's really important to treat a whole cosmetic unit, because you don't want one part of skin looking really nice, young and photorejuvenated, surrounded by old skin. So one other really good benefit with this laser, it's really efficient in its design. It's nice and light with a handle, but it allows for quite fast delivery of the energy over a bigger area, and that random pattern means the patient tolerate it very well, so you don't have to interrupt the treatment to give patients a rest. And I think the big thing, if an operator is comfortable when they're using a laser, they're going to be able to be more meticulous, really careful and thorough. The worst thing is if you're strained, you haven't got a good position, or you're getting tired. Unfortunately, you don't always do the job you want to do. So it's important it's got good ergonomics for the operator, but a whole lot of extra things built in for both patient comfort and patient safety, and that's that random pattern, the speed of delivery, the smartness of the delivery mechanism. So overall, we love this laser because it's a good experience for patients and really nice to operate. So one of the other things we love about the Lutronics ULTRA 1927 is it gives us the opportunity to treat otherwise challenging skin types. That in Australia we get a lot of background sunlight, and pigmentation is a big issue, but for a lot of particularly females and younger females, hormonal pigmentation of melasma can be an enormous issue. People want it treated, but the important thing is we've got to be able to repair their skin safely and do something to improve their melasma control. But unfortunately, there's not one treatment that is perfect for treating everyone with melasma. But the good thing with this laser, it's random mode, its adjustability means that we can effectively target the surface layer of the skin where people have many problems. We can gently repair the interface between the top layer of the skin and the collagen layer, which is damaged in melasma patients. But then we can also improve the collagen layer, which seems to be really important for signaling pigment disorders with the skin. So it is a good one to treat these patients, treat them effectively, but we've always got to be careful and safe in what we do. But as I mentioned before, one of the best parts is what you put on the skin immediately after treatment that can help prevent the problems and improve your control of pigmentary skin disorders. So with the Lutronics ULTRA 1927, it's a nice flexible device, and being non-ablative, it also means it's quite safe to treat areas which can be quite delicate, slow to heal, and where sort of delayed healing or recovery could be an issue. So the main area we treat is the head and neck, which has a big impact on people, and it's a great option there. But often the sun damage décolletage is also a really good one, that people get the pigments, the dyspigmentation, but also often pre-cancers. And in this area, if you do a really strong laser, there's a bigger risk of scarring and poor healing. So the good part of non-ablative laser is one of the safest options, and the adjustability with this laser makes it a really good option in these patients for doing it safely. Other areas where people are very damaged in Australia is the back of hands and the forearms. And again, with any sort of strong treatment, they can be sort of slow to heal and problematic. And the fractionated nature of this, along with its non-ablative nature for healing and safety, means it's a really good treatment option. But as it sort of very close to ablation in its benefits. You can get really good rejuvenating effects, and the added benefit is a good anti-cancer or reducing a risk of future cancers as well. So one of the areas many Australians like to have treated is around the periorbital area, and this is sort of a good treatment option for this area. It goes to treat sort of the very surface layer of the skin where you might sort of have age spots and other problems. It repairs that basement membrane zone, but it also really gets deep enough into the collagen layer around the eyes that you can actually get quite a good tightening of skin, a reduction in wrinkles and a reduction in lines. So although normally this is only good for fine lines and wrinkles around the periorbital area, due to the thinness of the skin, you really can get quite a good rejuvenating effect. But again, you get it with the safety of a non-ablative laser, less downtime and good recovery and healing. So one of the other reasons I really like the Lutronics ULTRA 1927 is its flexibility for what you can put on afterwards to enhance its benefits. So the laser itself is great for improving surface level skin changes or sun damage, be it age spots, pre-cancers, or just that loss of that nice even texture of the skin. But it's also very good for that collagen remodeling to give more of that collagen glow to the skin and help those fine lines and wrinkles. But depending on the type of problems people have, what you put on afterwards can be very valuable. So say if someone has pigmentation problems, putting on C ferulic acid or a high vitamin C concentration can really help that pigment response. You also want to do things that are going to help with that collagen response afterwards, and that could be peptides, again vitamin C, and even sort of retinoids afterwards. And when it comes to preventing problems, we also add other things to speed healing, enhance the recovery, and say would add things like tranexamic acid to try and reduce risk of post-inflammatory pigmentation. So it really is a good device for addressing things, but the opportunity to do that transepidermal delivery of actives afterwards makes it a safer, better treatment again. So what's the usual sort of protocol for treating people using the Lutronics 1927? You've got several choices that most people will opt to have a series of around 3 treatments for treating photo damage or aging. And the benefit of that is doing things sort of regularly every 4 to 8 weeks. You prime the skin, you get a bit of response with subsequent treatments, but you don't have to have sort of a lot of downtime. So you'll have a bit of redness, a bit of a sunburn effect for a day or two, and then more just a dry sandpapery feel for a few more days that can be covered up. And you're really looking pretty good after 4 to 5 days. But unfortunately there are some really sun damaged Australian skin where you want to go a bit harder, do a more denser treatment to remove a lot of those troublesome lesions, and then you really are looking for 5 or 7 days of cosmetic and medical downtime when you really want to protect yourself from the sun, and you might not want to be keen to go to work, but most of the time you can really just have a 1 or 2 day downtime. The other sort of option when people have problems like melasma, we might go over more gently and do a series of 6 treatments with really next to no downtime, or just a bit of erythema or redness and a bit of dryness the next day. And that again, you can get those cumulative benefits over a series of treatments.